Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist, and today I'm going to talk about some of my favorite prescription dry eye medications. As a dry eye and cornea specialist, I see a lot of patients as a second, third, or even fourth opinion for their dry eyes, and many times these patients have exhausted many of the conventional treatment for dry eye. So in this video, I thought I would explain how I approach prescription dry eye medication and some of my current go-tos. First of all, I always advise every dry eye patient to start a preservative-free artificial tear, no matter what kind of dry eye they have. Tear replacement is helpful to relieve dry eye symptoms, but they do not address the underlying cause of the dry eye, and sometimes tears are not enough to provide relief. An eye that does not make many tears has aqueous deficiency. For this type of dry eye, I like to block the drainage system of the eye to keep tears in longer with plugs, generous amounts of preservative-free artificial tears, and sometimes I will resort to prescription medication to increase tear production. Tyrvaya is a new medication by Oyster Point that just came out onto the market in the fall of 2021, and this nasal spray works to stimulate the trigeminal nerve inside the nose to help stimulate tear production. Many of my patients have found it helpful in increasing tear production and decreasing the amount of artificial tears they have to put in their eye. The more common type of dry eye is when the eye makes tears, but the tears evaporate quickly due to a lack of an oil layer. This is called evaporative tear loss, and I like to address the underlying issue for this type of dry eye. If there is inflammation on the eyelid margins that suggests that there is an underlying condition called ocular rosacea, my go-to treatment includes anti-inflammatory medications, such as a combination of a low-dose steroid eye drop, cyclosporin drops like Restasis and Cequa, and lifitegrast, otherwise known as Xiidra, depending on the level of inflammation. Icevis is the only FDA-approved steroid eye drop for dry eye and is made of loteprednol 0.25%, which is a very low-dose steroid drop that is effective at decreasing the inflammation on the ocular surface. At this low of a dose, we do not usually expect many side effects, but one downside is that chronic use of any steroid may accelerate cataracts and may also induce higher eye pressures, so we need to use steroid eye drops with caution. Medications like Restasis, Cequa, and Xiidra are also anti-inflammatory eye drops that work to combat inflammation on the ocular surface, but do not have the same immediate effect that steroids have. Many times, I will start a low-dose steroid eye drop like Icevis in order to bridge to a long-term dry eye medication. Another unique cause of dry eye is lack of corneal sensation. This condition is called Neurotrophic Keratopathy, and in its mildest stages may present with dry spots on the cornea and manifest as blurry vision instead of eye pain. Without good corneal sensation, you lose your tearing reflex, your blink reflex, and your ability to make growth factors to help with corneal healing. The most common culprit I see for this type of dry eye is after LASIK surgery, but we can also see this with certain medications and eye drops, other eye surgeries, and even medical conditions like diabetes. When artificial tears do not seem to help, I like to use a medication called Oxervate, which is recombinant human growth factor that helps with corneal healing. For mild to moderate neurotrophic keratopathy, I have found this extremely helpful to improve quality of vision. Have you been on any of these medications? Let me know in the comments below. Please like and subscribe, and thanks for watching. I'll see you in my next video. Bye!